Heart attacks and angina are both heart conditions that result from reduced blood flow to the heart muscle, but they differ significantly in severity and implications. Symptoms of a heart attack usually include a sudden and intense chest pain, often described as a feeling of pressure, tightness, or squeezing, and can be accompanied by shortness of breath, nausea, and lightheadedness. In contrast, angina typically manifests as chest discomfort during exertion or stress and generally subsides with rest or medication like nitroglycerin. Treatment for heart attacks may involve a combination of medications, lifestyle changes, and potentially urgent procedures like angioplasty or bypass surgery, whereas angina is often managed with lifestyle modifications and medications to improve blood flow or reduce the heart's workload. Risk factors for both conditions include high blood pressure, high cholesterol, smoking, diabetes, and a family history of heart disease. Here are detailed aspects of both heart attack and angina to help differentiate between these two important heart-related events. Symptom onset, sudden versus gradual. The distinction between the symptom onset of a heart attack and angina is critical in diagnosis and treatment. A heart attack or myocardial infarction typically presents with sudden, intense chest pain that may radiate to other areas such as the arm or jaw, often accompanied by a sense of doom, shortness of breath, and sweating. This is a medical emergency, as it signifies that the blood flow to a portion of the heart is severely reduced or cut off, causing tissue damage or death. On the other hand, anginal pain is usually more gradual in onset and occurs predictably with exertion or emotional stress. It's often described as a pressure or tightness in the chest and is relieved by rest or medication, such as nitroglycerin. Angina indicates underlying coronary artery disease, but typically doesn't involve the immediate death of heart tissue. Recognizing the onset and nature of symptoms is crucial for prompt and appropriate medical response, potentially saving lives and heart function. Pain duration, prolonged versus transient. When distinguishing between heart attack symptoms and those of angina, a key factor to consider is the duration of the chest pain experienced. During a heart attack, the pain is usually prolonged, lasting for several minutes or even longer, and it can be accompanied by pressure, fullness, or a squeezing sensation that may radiate to other areas like the arm, neck, or back. This occurs due to a complete blockage of blood flow to the heart muscle. On the other hand, angina is typically characterized by transient chest pain, often triggered by exertion or stress, and relieved by rest or medication such as nitroglycerin. Angina suggests a partial temporary blockage or decreased blood flow and acts as a warning sign of underlying heart disease. Both conditions require immediate medical attention, but the persistence of pain in a heart attack underscores the urgency for swift intervention to minimize heart damage. Trigger factors: unprovoked versus stress-induced. Heart attacks and angina both involve chest pain due to reduced blood flow to the heart, but trigger factors play a key role in differentiating them. Heart attack pain is typically unprovoked, occurring suddenly and unexpectedly, often even during rest or sleep, reflecting acute and critical blockage in a coronary artery. Angina, however, is usually stress-induced, triggered by physical exertion or emotional stress, which increases the heart's demand for oxygen-rich blood. This pain generally subsides with rest or medication like nitroglycerin, distinguishing it from the more serious, persistent pain of a heart attack that requires immediate medical attention. Identifying these triggers is crucial for appropriate treatment and management of coronary heart disease. Relief pattern: unrelieved by rest versus alleviated by rest. When distinguishing between the symptoms of a heart attack and those of angina, the relief pattern offers key insights. In the case of angina, symptoms typically subside with rest because resting decreases the heart's demand for oxygen, hence alleviating the temporary mismatch in supply and demand causing the pain. Angina can often be relieved by nitroglycerin as well, which helps to dilate the blood vessels. In stark contrast, the symptoms of a heart attack, such as enduring chest pain, tend not to dissipate with rest. This is because a heart attack generally involves the sudden and complete blockage of a coronary artery, resulting in the death of heart muscle tissue, which needs immediate medical attention regardless of any change in physical activity. Recognizing this difference is crucial for timely and appropriate medical intervention. Relief pattern, unrelieved by rest versus alleviated by rest. When distinguishing between angina and heart attack symptoms, the relief pattern can be a vital clue. Angina typically presents as chest discomfort that occurs with exertion and is usually relieved by rest or medication, such as nitroglycerin. This is because angina is often the result of temporary, reversible, inadequate blood flow to the heart muscle. On the other hand, the pain or discomfort from a heart attack is persistent and not alleviated by rest or routine angina medications. A heart attack indicates that the blood flow to a part of the heart has been significantly reduced or blocked, causing damage to the heart muscle. Immediate medical attention is critical in the case of a heart attack to restore blood flow and minimize cardiac damage.